Chief Medical Officer Dr. Roshan Parasram says one of the new Canadian coronavirus cases which traveled from Trinidad and Tobago is no cause for concern for the population at this time. In a media conference in Canada on Tuesday, Alberta's Chief Medical Officer Dr. Dina Hinshaw said the 7 people who have most recently tested positive for the illness in the province were confirmed travel-related cases who are now recovering in isolation at home with support from medical health officials. While speaking at a Public Administration and Appropriations Committee today, Wednesday, Dr. Parasram said the person who traveled from Trinidad only presented symptoms on their arrival to Alberta.
And fast, they would have probably not have symptoms at the time because you usually can't board an airplane with symptoms. So the chance of transmission is extremely low, if not nil. So that is the part we should be concerned about. But until we get the epidemiological data from Public Health Canada, it will be speculative to say what are the different, there's a host of different iterations of scenarios that could have played out during the course of the time.
He explained what the epidemiological data would reveal to the ministry.
Where the person, who is it, first of all, where they would have traveled to determine when they would have come to Trinidad, so we can at least list and see who they would have been in contact with, that sort of thing. What I have learned based looking at the clip is that, of course, she does not know. She said that she didn't know at this time all the details of travel. So they would first have to interview the client, do a thorough public health history, and of course, once they have that at hand, then they can transfer it to us. Yeah. So I think they will do it as soon as they have it at hand.
The committee met today to discuss the preparedness of public authorities for the potential spread of the novel coronavirus COVID-19 in Trinidad and Tobago. And Health Minister Terence Dialsing has also responded to news that a person who traveled through Trinidad and Tobago tested positive for COVID-19 in Canada. Alberta health authorities made the disclosure on Tuesday with the caveat that they are not sure in what country the person actually contracted the virus. Minister Dialsing said the Chief Medical Officer of Trinidad and Tobago will get in touch with his counterpart in Alberta, get the necessary information about the case. Minister Dialsing was speaking on the Now Morning Show earlier today.
Which country the person traveled through and in which country the person contacted coronavirus.
Yes.
There is no way. I am asking again, I am pleading again to mainstream media again to be responsible in the way we are reporting on this. It is causing undue fear, undue panic.
He also responded to criticism from the opposition which suggested that Tobago was not ready to deal with the virus.
So I want to tell the UNC and Chrislyn Moore and Ashwood Jack, please do not instill more fear where there is no fear to be instilled. Yeah. This is not a political game. Yeah. Tobago is part of the national COVID-19 response.
And in its daily update, the Ministry of Health says as of Wednesday morning, 40 samples have been sent to the Caribbean Public Health Agency, CARPHA, for testing for COVID-19. None of these samples have tested positive. Meanwhile, Prime Minister Dr. Keith Rowley says travelers from Germany, Spain, and France will not be allowed to enter Trinidad and Tobago due to the outbreak of COVID-19. Travelers on flights originating from Italy, South Korea, Singapore, Japan, Iran, and China have already been subjected to a 14-day wait before entering Trinidad and Tobago. On Tuesday, Dr. Rowley said that the action is taken as COVID-19 poses economic as well as health challenges.
Uncertainty is there, and that the virus, the absence of knowledge and control and containment of the virus, that uncertainty has driven, one can say, panic in the international marketplace with all kinds of consequences to which we are not immune. And this is what I was alluding to when I stated the last time that we are in a place where our economic concern is as great as our health challenges